Hello, everybody. This is Irina Strunina. We are back. This is our podcast, Diabetically Speaking with Smart Move 360. This is where we go live in our Facebook group and also YouTube and LinkedIn. And I invite experts in healthcare to talk about diabetes. Unfortunately, this is a topic that not really very well um, in we don't have too much information about it. We have the horror stories, we know that. We've heard about some people who got diagnosed and their life is not that much fun. But we don't really know what it is, how does it work, why it happened. So I am inviting experts to talk about it so they could educate us on this. So next time when you see the doctor, you could ask them educated questions and understand the response. Or you could understand what the person who you know is going through, and maybe you could give them an idea. Hey, check this out. This YouTube channel, this is Diabetically Speaking with Smart Move 360. You could find there are a lot of experts who are sharing this information, right? So today, I invited the very interesting guest. I met him on our Facebook, Diabetes 101 for Beginners. He came to our Facebook group and started sharing great information and a lot of information. And I'm thinking, who is he? Why he is there? So I reached out and he responded and we connected and he agreed to be a guest for me today. So Dr. Caleb, welcome to the podcast. Please introduce yourself. Tell us about what you are doing, why you are doing, why did you come to our Facebook group, and what is your motivation? And we'll see what else we could talk about.
Well, I thank you, and I appreciate you, offering me the chance to come on here and talk to people, and also be a part of the Facebook group so that I can, share more information. So I'm an advanced practice pharmacist, which is like I go to school, I became a pharmacist, and then I get extra training and credentials. I'm board certified, I'm residency trained, and so I can actually prescribe medicines when I collaborate with providers, kind of like a nurse practitioner or a PA. And so I guess I'll back up. The reason that I went into this field is because I had a family member. My grandfather was my best friend, and he got very, very sick, and his disease state was mismanaged in combination with his metabolic health, diabetes, cancer. But the medical field kind of dropped the ball, and so he passed away due to complications from his disease states. But he would have lived a lot longer if he would have had the right care and also preventative care to prevent this from happening in the first place. And the last time we ever talked, he told me to go into a space to help people where you can prevent this from happening to others. And so that's what I've done ever since that day. I went to school, and so I learned as much as I could, and not just about the medicine, because pharmacy school is a lot about, the drugs. And so my whole philosophy is to get people off of drugs, which is kind of counterintuitive of being a pharmacist. But I can see that they're not the answer. They're kind of band-aids. They can be very helpful in certain situations, and I'm not telling everyone to get off of drugs. But my philosophy is to see if we can use lifestyle modification, functional health medicine to get people off of drugs and using, diet, exercise, sleep, stress resiliency as a method of health. Um,
Absolutely.
yes.
All right.
Were there another part of your question? So let's say, oh yeah, so my story. So after school, me and one other pharmacist built a clinic in the state of California
Mm-hmm.
where ambulatory care pharmacists, where pharmacists like myself can see and manage patients' care. We can order labs, prescribe medications, start, stop, change, do anything that the providers can other than really like surgeries and physical examinations. And so we built a clinic out there, seeing hundreds, if not thousands of patients. And that became highly successful, where we were focusing mostly on diabetes just because that's where the need is the most. and getting people off of drugs while improving A1Cs. I think our average A1C reduction for the clinic for the state of California was over 3.5%.
Wow.
So people were, I mean, I had patients that were sent to us with A1Cs 15% or higher than the machine could even read. And by the done of our care, they'd be on no drugs or little drugs and have A1Cs just like me. You never knew that they had diabetes in the first place. But
Mm-hmm.
averaging about 3 to 4% reduction in that cohort of people. Um, and then my wife and I, we left the state of California and moved to Texas, where we're expanding my services outside of that clinic because it was for another healthcare organization, doing it with myself. And so just not just focusing on diabetes, but kind of longevity medicine and not just helping people live longer, but live better, higher quality
Yes.
lives. And metabolic health kind of fits into all of those pieces, and diabetes is a piece of that. But if you're metabolically healthy, like your insulin is low, your blood sugar is low, your cholesterol, your blood pressure, and your weight are all in the right parameters, that kind of like is the gateway to diabetes. So it kind of just there's a gateway between them, and so it kind of just all fell together that way.
Absolutely. This is a great point you said. Absolutely. The medicine, the science, the all the developments that science and medicine itself, not the pills, but the the science of medicine, they're pretty well developed by now. And doctors could create for you the regimen, medication regimen that you will live long. But what quality of life you get
Yes.
there,
Yeah.
that's a different story. So medication will allow you to live long. Then it's up to you how you will live those years. Will you be constantly just staying on schedule when to take your pills, or actually take an active role in this, right? And improve your health, the lifestyle, all these activities that you mentioned, and enjoy those extended years of your life, right?
Yeah. No, I agree. And I think there's one of my mentors, his name's Dr. Peter Attia. He has a longevity curve that he talks about. And lifespan kind of has gone like this over time. And so we've lived longer and we've lived longer over the last like couple hundred years. Obviously, medicine, antibiotics, and things like that. But we're living longer, but like say if you're living 20 years longer, like say you're living to 95 when the average is 75, but you're in a wheelchair
Hmm.
or you've had a foot cut off or you're in a bed or you have heart failure or just a whole assortment of issues, chronic diseases that you can have. Yeah, medicine has allowed people to live longer, but at what quality? And if you're just at home watching TV and you can't physically do the things you want to in life, what was really the point of that? So
Yes,
preventing those chronic disease states, because they start, in your 30s, your 20s and 30s and 40s, you don't even think anything's happening, but it's a buildup over time. And so
exactly.
preventing those things from happening. So letting people not just live to say 100, but having a very high quality of life and then, going in their sleep or their health only declines for like 6 months and then they die instead of 30 years of the slow decline of just awful quality. And so we're trying to prevent all those things.
Yes, absolutely. I totally agree with you. Prevention is the key, and consistency is the king. So this is kind of like we got to consistently take actions, consistently be active in our own health, right? So perfect. I'm so glad to hear you that you, being the pharmacist, and you do know how the medication work, uh, but you also know that if you do nothing, just take the medication, eventually our body adjusts, right? So,
Yeah.
and
Yeah.
you need to make some adjustments with medication. And if you did not do anything, it means more medication may be stronger, maybe a big amount, right?
Yeah. Yeah. No, I mean, that is true. And the body's very, very good at adapting. So it's awesome that the body can do that, but it can be negative if you're not going to use that to your advantage. Um, the thing that I talk to patients a lot, because a lot of people get diagnosed with diabetes and they get sent to me, and sometimes they'll be on meds for 30 years and I'm seeing them for the first time, or they're just getting diagnosed.
Uh-huh.
And it's just educating them on like what is diabetes and what are these meds doing. There'll be people on metformin for 20 or 30 years and they're like, I had no idea that's what it does. Um,
Mm-hmm.
and just educating people that it's not just a disease, it's not a disease, it's a condition. It's 100% reversible. So a lot of people are like, I have the diabetes, I have a disease, I'm going to be on my medicine for the rest of my life. And that's a total lie. We can improve your condition and we can reverse your condition. It's a condition of elevated insulin, not of elevated blood sugar. So blood sugar accompanies it. It's the thing that we look for because we're always checking A1Cs and blood sugar, and those are the surrogates that we're checking. But really, if we were checking insulin in labs like over this last 2 or 3 decades, we would have caught prediabetes and even precursors to prediabetes before people were ever diagnosed with diabetes because insulin is really the body's signal that something's not right. And
Mm-hmm.
so what we've done is like, metformin and insulin are probably the most common. Other than the last few years, we use a lot of like the Ozempics and the Mounjaros and stuff. But
Yes.
prior to that, we were using a lot of insulin and metformin. And the metformin can work, but the insulin, if you're diagnosed with a condition that your body already has very high insulin, why would you inject more insulin? Because insulin it's forcing the sugar in your blood into the muscles. That's what the body's telling you to do. It also does a very important other thing where it tells the body to store. So if you have high insulin and you're trying to lose weight, you're never going to lose weight, even on a caloric deficit, because insulin's the master regulator. It's going to tell your body, store, 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 store. So you have this condition, your doctor's diagnosed with diabetes, you have high blood sugar and high insulin, and then they're going to tell you, oh, I'm going to put you on insulin so that we can help your diabetes. So now let's just say, for sake, your insulin's 25. We'll just say the level is 25. Now we push it to 50. And short term, we've forced a lot of that sugar in your blood because your A1C is probably 9, 10, 11. We've forced your A1C down because the sugar in the blood has moved from the blood to the muscles. So you've gained some weight because it's still there. It didn't leave the body. And it made the receptors on the muscle sites more resistant to insulin. And so we've just made the problem worse than it already was because you were already insulin resistant in the first place. So I guess big picture, if you're diagnosed with a condition with a high level of insulin, why give more insulin? You're only going to make the problem worse. And so I see that a lot with patients that are on like 1 to 2 units per kilogram per day, which is a lot of insulin. I like to do, when I use insulin, I dose it by the body weight because
Mm-hmm.
everybody's a little bit different. And sometimes
Yes.
we do use a little bit of insulin and patients improve well, but it's also people that are more bedridden and can't do a ton of activity.
Yes.
Because as a side note, um, insulin resistance can be improved dramatically by exercise, whether that's cardiovascular exercise
Mm-hmm.
or weight training, resistance training. Those make your receptors of your insulin in your body super sensitive. And so I'm probably going over a ton of information, but
Well, this is something that I actually like to hear also because we hear it so often in our Facebook group, Diabetes 101 for Beginners, when people are saying the doctor prescribed me insulin before even trying anything, now I'm doomed. Or people in such a bad shape and they say, I don't want to take insulin. I don't want to be for the rest of my life on the insulin. These are two different situations, right? And sometimes you have to really, look at every individual
yeah,
separately and don't assume that if the entire, say, Facebook group is saying don't take insulin, that you will not take the insulin. It's like we are not the cult here. We are
yeah.
actually trying to provide as much information and help you as much as we can instead of forcing you to do something that is not good for you.
Yeah, no, I 100% agree. And I've already noticed in a lot of, like, say, that Facebook group or other Facebook groups where, like, there'll be one person saying one thing and then someone saying the exact opposite, like, insulin's good, insulin's bad, fiber's good, fiber's bad. And there isn't one diet that's going to work for any human on the planet. There isn't one medicine that's going to work for every single human on the planet. So
Exactly.
everybody is different. There's an individualized part of medicine, and that's I think where the future and where medicine is going is you're going to get a lot more of an individual take on it. But yeah, it's evolving too, with specifically with diabetes, just because we have new medicines that are available now. And so in the last 5 years, it's changed even before that, with Trulicity was out before that. But Ozempic is now so popular, and now Mounjaro. And
Yeah,
so, and that's not an insulin. A lot of people think, oh, it's all the injectables are all insulin. It's not an insulin. It can be helpful. It is way better than insulin itself, but it still has its issues too. So, I mean, it's still a Band-Aid. But yeah, I think just not saying like on these groups that you're talking about with the Facebook diabetes groups, not just you can go on there for information, but if you're going to make a clinical decision about your health, you should chat with someone that is a specialist, just because like people look for supplements or like this secret miracle cure that's going to change everything, like berberine or apple cider vinegar or something, and
yeah,
those
yeah.
are helpful. Those are low-hanging fruits, but like if you don't fix the pillars, the exercise, the sleep, the diet, the stress resiliency, those are going to barely budge anything. So
Absolutely.
you really need to individualize it, and then you need to, have advocates like say myself or you or other people that are really educating, and not just like, hey, get on this drug, or hey, this worked for me, so it's obviously going to work for you, and it's just not always the case. So,
Absolutely. This is something that the recurring topic in my conversations with many health professionals lately, just like in the last several days, I noticed that every person I'm speaking with, we are coming to the same conversation that you, if you go to Facebook group, if you go to some community and someone is telling you that they've got great results, there will be so many questions. Oh, tell me how you did it. Or teach us. Or share your diet. Or share what you do. And this person who first came to the Facebook group to say, I got these results and it's doable. So you need to work on it to get the results. Very often they are not there to say, I have a blueprint and go ahead and follow my blueprint and you will get the same results. It's not.
yeah.
It's much better, in my opinion, to speak with the, as you said, healthcare professional, with somebody who deals with this condition on a daily basis, and not just one case, but multiple
Oh
times,
yeah.
multiple situations, could oversee the trend, could oversee the general direction where people go who take this path or that path, and they could actually help you to build your own path that will work for you individually. So it's coming again and again. Yes, personal experiences don't make you an expert.
Oh yeah,
Personal
for sure.
experience makes you an advocate,
Yeah.
makes you a spokesperson for healthy changes, but not for the path, direction that everybody has to follow. It's all very individual.
Yeah. Yeah, and I think we're now in a unique area with everything, but in health specifically, because of the issues that we've had. We're the sickest, one of the sickest countries, but we spend the most on healthcare, so that makes us very unique. And we're in this time where most of the information is available that never was, like say 20 years ago or even longer.
Yeah,
Like there wasn't YouTube, there wasn't the internet, and now you can look up anything, but how do you know what's really like true information and not? So how I look at it is, because I talk to doctors and other healthcare providers, and when I'm collecting data, I have something in my mind that's like, oh, that makes sense, or that doesn't really make sense, so we can talk about it. But what's a good way for people to look at uh, like not just saying like, say you had a lot of relief and you had diabetes, but now your diabetes is cured, and you go
mhm,
on and you say that to everybody. Well, my question for you would be like, well, who did you see? How did you get help? And then how many people has that person helped? So if you were to go have surgery like on your knee or something, do you want to have the surgeon that's done 10 surgeries, or do you want to have the surgeon that's done 10,000? And
Exactly.
then because they've seen so many cases, the rarest cases, the weird cases, the normal case. And
Yes.
so they can advise you the best and not just like, well, I've seen this doctor that's seen 10,000 people, but he's prescribed statins 5,000 times. Like, okay, they're still going to be helpful information, but if you're not looking for the route of just, taking a medicine for the rest of your life, then look for that provider that has seen lots of patients and have lots of results to show for it.
Mm-hmm.
And, people that can speak for that, not
Yeah.
just selling a product. And, there's a lot of people in the health space now, like these like longevity experts. There's a lot of good things that they're sharing, but there's also like they go overboard and then people get like stuck on like, well, what salt am I going to use? And like just the things that are not going to help them like long term. And then they get worried, like they get overwhelmed because there's a lot of information out there. So being part of these groups is helpful, but it's also like, take a little bit of a grain of salt. If it's not from like an expert, it's from, just your neighbor.
Group member. Yeah.
Yeah.
Yes, I totally agree with that. This is something that I really would like to change in my Facebook group in Diabetes 101 for Beginners, because I see that people come to the group first, they got diagnosed and didn't get much direction. Then there are people who got diagnosed a while ago and they tried this and that, and now they look for something else that will work for them just like this. It's not going to happen.
Mhm.
So I would like people to hear all these stories and start looking for the guide who could help them to pick the right path for them, because we all come from different background, different family traditions, and all this uh,
Yeah.
walks of life, and people live in Louisiana have very different tradition than people living in Oregon. And you got to take this into consideration when prescribing somebody a specific even way of eating or
Yeah,
exercise.
yeah, yeah.
So now I'm dying to ask the question that goes with your introduction. We don't have much time to go, but I need to hear that. You said about the clinic that you had in California. It didn't sound to me just a regular Wellstar or Kaiser clinic. It sounded to me something very different. Can you please tell about it? Is it uh, in many places, or it's your personal
Oh, I see.
development? Or also another question, if that clinic, because we have a lot of people from California in our group, is that clinic work with the insurance companies, or it works some different insurance alternative approach? What Tell me, please. I'm curious.
So that clinic, an ambulatory care pharmacist ran clinic, it's not brand new. Kaiser Permanente does have programs like that for pharmacists. They have about 1,000 pharmacists run uh, managing patients all over the state of California. And
Mhm.
so we took the good parts of that model because I did my residency at Kaiser, but I didn't like how they just stick you in a box. And
Yes.
so I wanted to have unlimited options for everybody, but also they
Mhm.
have like yeah, anyways, Kaiser. I took the good things and but we didn't limit it and we made it very specific to patients. So pharmacists can manage patients as long as they're under what's called a collaborative practice agreement. That just means like a nurse practitioner or PA, how they're underneath a doctor and they can prescribe meds and order labs, but the doctor still oversees things. That's the
Mhm.
same kind of relationship that we have with the MDs. But what I noticed at the organization we built, the MDs were so bogged down with so many things that they weren't up to speed on like the new treatments, the new data, everything. And so they would refer us so many patients, especially for diabetes, because they were dealing with more complicated patients outside of just diabetes. And so that's how the program grew. So it's not specific to California. I didn't come up with the idea, but I guess I took this program that's existed for like 10 or 15 years and made it to like, well, how do we incorporate what you're eating and what you're doing and like changing your mindset? Because a lot of people come to me like, oh, I'm gonna die because this is it. My doctor told me I have diabetes for life, and it's just changing like Well, no, it's not a disease. It's a condition. It's 100% reversible. You don't have to be on meds for life. And it took you 20 years to get here. So it's going to
Yes.
take us time to get you where you got to go.
Yes.
You, a lot of this is silent until you have a heart attack or a stroke or a huge thing in your life or a very, very stressful event. And people think, like, because they're not feeling it, that nothing's happening. Like, well, that's why
Hmm.
it's good to get blood work, at least annually. But to answer your question, it's not specific to California. I no longer associate with that clinic there. They ended up just going in a direction that wasn't really, it was more about money than it was about patients. And
Hmm.
that's not really what I'm about. And so that's why my wife and I are building out a clinic completely separate that's just us. And so that we can do that together and really help people without charging them insane amounts of money. Um, and also building a community. So we're building out a community. We have a platform for like a health blueprint. So it's like the
Hmm.
basics, like the pillars that I talked about, like
Yes.
how to exercise. Because a doctor will say, well, you need to exercise and you need to eat healthy. And they're like, so do I eat salads? And do I just walk? And like, what does that mean? And so like really building a plan that's individualized to people. So the platform we'll have access to like an AI platform where you can put in like your weight, your height, what
Yes.
injuries have you had in the past, like your story, and it'll build out like, well, you should build out this diet plan and based on these many calories, this much protein, and it's all protein centric, protein centric. Every diet
Yes.
needs to be protein centric, unless you're like a hemodialysis patient for the most part.
Yes.
Um, or like an exercise routine. And then that's the starting point. So you will see results if you are consistent with almost any program. But once you
Hmm.
get to, let's say you've improved 50% and you're kind of plateauing, that's where I can come in and now let's take it to the whole next level. Like we fixed this, this, and this. Now, well, maybe we can decrease the dose of this medicine, add this supplement. Your protein's actually not high as it should be. Like we can play with things.
Yes.
But, to help more people, that's why this platform we're building will exist so that you can go on, you don't have, like, I can only talk to so many people at once, right? And I could be on a podcast with you and say 1,000 people are listening, but it's not individualized, right?
Yes.
But it'll get them halfway there and they can put the foundation in place. And then I can really come in and be like, well, you're not doing any really high intensity zone 5 level stuff for someone that's like 40 or 50 or 60.
Yes.
Or you're not doing any cardio activity. No wonder you're having trouble breathing, walking from here to there. So,
Uh-huh.
um, but yeah, it's called a functional health blueprint. I'll give you access to that, and we're going to do a huge discount for anybody that listens to the podcast. So,
Perfect.
yeah.
Perfect. Yeah, we will put the information about this program in the section that describes the podcast. So definitely will be available here. Are you so you can prescribe the medication? Can you prescribe to somebody? So you are in Texas right now, and I'm in Georgia. If somebody in Georgia will contact you, you can prescribe them something as well?
So I'm licensed in the state of California and in Texas, so I can prescribe there as long as I'm collaborating with a physician in one of those states.
Uh-huh.
Um, but my goal isn't really to prescribe medicine. I have the ability to do so, but I don't want to go get licensed in all of these states that just have the ability to prescribe when my
Yes.
goal isn't really to prescribe meds.
Okay.
And most
Got it.
people can go see a doctor and get medicine, and we can adjust things.
Mm-hmm.
But that's not really my goal, and there's so much we can do outside of medicine.
Yes.
Also, you can bring all your medicine to me, and I can advise you on how we can manage that. And I can even talk with your doctor
Yes.
on how, like, we should best taper you off of insulin, not just stop it, and
Mm-hmm.
what we can do in its place and why we're going to do those things. And I think if we, again, the mindset thing, if we explain why all these things are
Yes.
happening, then people are way more likely to buy into it instead of, all the patients that have come to me and you've probably seen, I've been on metformin for 20 years and I have no idea what it does. I just do it because my
Mm-hmm.
doctor tells me.
Mm-hmm.
And so we're just educating on like why are we doing the things that we're doing? Why are we even in this position? How did we get here? I mean, there's no education on like say
Yes.
financial stuff and health. You don't get that in high school in the United States. You don't get any of that stuff. So just laying a foundation for like what should we know and how do we get where we want to go?
Exactly. Caleb, this is great, great conversation. And I love the fact that we talked about it. This is something that people should really take into consideration at least. Listen to it and maybe listen a couple of times. And I would love everybody who is listening to our conversation today to share it with with those who didn't have an access to our YouTube channel, for example, which is called Smart Move 360, because we have these and other conversations recorded there. We also have the people who were diagnosed and they are sharing their struggles, their challenges, their wins, their results. So to hear those life stories also very helpful. So I strongly recommend everybody to just visit our channel more often, means subscribe to it, but just to go there and see what we have there. It's great source of information, and I am so glad that we can add this piece, today's interview, to that collection that we have there. So we will put the link that you gave me to into description of this episode. That's wonderful. I also wanted to remind everybody about a couple of things that we have in our Facebook group, Diabetes 101 for Beginners. I wanted to remind everyone that every Wednesday, where is my button? I lost the button. Every Wednesday we have the support group meeting at 7 p.m. Eastern Time. We meet in a group with the people who can come with their challenges. And by the way, Dr. Caleb, if any time you would like to join us there, we are always happy to talk about different ways how to manage medication, maybe ways how we can improve our situation to lower medication, or maybe even compare that, I have this, I have metformin and insulin, and I also taking lisinopril and some statin and whatever. What if they kind of not working together? Maybe I need to change something. It's just the invitation to join us on that on those meetings. We also have our dietitian joining us there regularly. Kim Kyle is always happy to help out, and some other healthcare professionals periodically join us there. Kim is more often than anybody else. So that's on Wednesday. Of course, on Thursdays, we have this Diabetically Speaking with Smart Move 360. With Kim, every month we also run this Diabetes 101 for Caregivers crash course. This is a 2 hours show where we talk about different aspects of life with diabetes that caregivers very often don't get a chance to know about. They are not going to doctor's visit. They don't hear what doctor recommended, and very often the person who is diagnosed, they may forget what the doctor say, or they don't share what did the doctor say. And we as a caregivers really don't know what to do, what safe to do, what helpful to do. So I wanted to do something for caregivers, and that's why we started this project with Kim. And every month we have this 2 hours presentation and conversation and Q&A afterwards. So these are few things that I wanted to share. One more thing, the app, I finally have the app. It's available on Apple and Google Store. It's called Diabetes 101. And this is really the hub. This is the place where people like Dr. Caleb and some other, and Kim and Trevor and many other people I invited to have their presence, so we could together bring to people help that will be readily available on everybody's phone right away, without the computer. And also the plan is that I also will be posting there everything that I find helpful from the standpoint of the purchase. Maybe the scale to kitchen scale that gives you not just the weight of your whatever you're wearing, measuring, but also how many calories in there. And this kind of stuff available. I'm working to get some coupons, discounts for CGMs for people who is paying out of pocket. I have a lot of plans. So the app is available. Not much on it yet, but download it and put the notification on. So once the new thing is there, you will be aware of it. So these are my announcements for today, so people know what is coming up, what is going on. And I wanted to thank you again, Caleb, for joining me here today. We got a little bit over 30 minutes, but not too much.
That's okay. I really appreciate you having me on.
Absolutely. Thank you very much, everybody. Stay healthy, be active, and keep moving. And we will talk with you next week.